Okay, so today we're going to treat this patient with RM microneedle tip. So first of all, we have this patient under the numbing cream, which we usually put on for the next 10 to 15 minutes. After the numbing cream is effective, under 10 to 15 minutes, we're going to remove the cream and proceed with gentle treatment. So we have the wrap and the cream. First, you're gonna remove the cream with dry tissue. Which usually takes about 2 to 3 minutes, so you're gonna have to wait for me. And after you've wiped the cream out with dry tissue, we usually recommend you to use some clean alcoholic tissue to wipe up the rest of the cream. And it's always best if you have asked the patient to wash his or her face in prior to the treatment. And while you are cleaning up the face, you ask the patient if they are feeling the numbness on their face. So, sir, do you feel the numbness on your face?
Yes.
Okay, good. So you have to ask to make sure the treatment is least painful as possible. You will start with your RF microneedle treatment. And you can see at the beginning, there is no tip. We usually insert the tip in prior to the treatment. Make sure the tip is sealed for sanitizing, that it's not opened. We do not recommend this tip to be reused. It is only for one-time use. So you open up the tip. You insert the tip onto the RN handpiece. You twist it a little to make sure it shows the blue light. And then the device will recognize the handpiece. We do have basic modes. So we do provide 3 basic modes for your convenience, but you can always change the options if you want to. The more painful the patient might feel. So we usually recommend that you start with thicker skin areas such as your cheek. So today we're gonna start with the patient's cheek. The protocols are already mentioned on the device, but then again, we also provide separate protocols, so you're free to use whatever protocols necessary. For this patient, I'm going to reduce the depth to 1.2 millimeters because it's his first time during the treatment. And then we're gonna keep the level 5, repetition in 1 second for me, RF time 70, and delay time, I'm going to put it as 150. So we're gonna start the treatment with insulated 25 pin. You usually press once to make sure you understand how the patient feels about the treatment. So we're gonna continue with this depth and this protocol, but if the patient feels painful, you can always reduce the depth or on-time RF time. So we're gonna start with the eye area and slowly go down towards the cheek area with the same protocol. So the treatment is very simple. So because I put 1 second repetition time, the needle comes out every 1 second. So you gently remove your hand every second, which would save your time on the treatment eventually. So after treating the face, you can see that the redness on the face slowly appears. This will disappear within the next 1 to 2 hours with proper cooling at the end of RF treatment. We're going to continue the cheek treatment on the other side. We're going to continue on treating to the chin area. There are different protocols for the cheek area. But for this patient, again, because it's his first time treating this, we're going to still reduce the depth to 1.2 and keep the RF time to 70, but put on delay time as 150, while the power is level 5. Once again, this is up to the doctor's choice, so you can always find the setting that you want. I'm going to try one shot on his chin, and if it feels uncomfortable, I'm going to readjust the power. So we're gonna start with one shot. You can see that the pins come out a little bit faster this time because the repetition time is 0.8 seconds. Just 5 more shots. This is a little bit more sensitive area, so you're still going to have to communicate a lot more with the patient. So I'm going to start with the treatment up here. You have to let me know if you feel uncomfortable with this. Is it okay?
Yeah, that was okay.
Okay, good. I'm just gonna increase the repetition time. And when you treat the remaining area of his forehead, you always have to tilt the head a little bit for better and precise treatment. Good. I'm going to treat the other part. See how my hand is very uncomfortable here, so I'm going to again tilt his head. Good. And finally, we're going to treat the patient's nose. Because the nose has a little bit more thicker skin, we start normally with 1.5 millimeter depth, but I'm going to reduce this a little bit. Keep the repetition to 1 second because the nose is smaller part, so it needs more sensitive care. RF time 50, delay time 150. Good. So after you have treated all the face, you can see that the redness comes up. Make sure you look for some empty spaces that you might have missed out, and you try to fill in those empty spaces. For example, you can see that the patient is missing this area, so I'm going to fill in this area with the basic protocol of the chin, which I put it as 1.2 in prior. Yes, so you fill in the empty area. After the RM treatment, you usually put on a cooling mask. So you make sure the patient has time to cool down the next 10 to 15 minutes. And eventually the cooling once again will come down in the next 1 to 2 hours max. The benefit of Gentilo's RF needle is that, as you could have seen on the treatment, there are minimal bleeding. If the needle itself is thick or not properly made, you will see there are bleeding on the face because of the needle penetration into the skin. But luckily for this patient, you've seen 0 bleeding, which makes Gentilo very different from any other devices that we have in the market. So this is the end of the treatment for RM. So this time we're going to use the RF 1-pin needle to treat different parts of the face, such as your blackheads or whiteheads or your acne. This patient does not have a special acne that we can treat with this 1-pin needle, but we're going to treat some of his blackheads and whiteheads on his nose. As you can see on the screen, this is the screen you get for RF 1-pin needle. You have your different power options and your on time, RF on time, and repetition time. Repetition time means that the RF will come out every 0.5 seconds. For his nose, we're going to use 1.2 millimeter depth needle. It's very tiny. And we're going to increase the power to level 5 for now. And we're going to increase the RF time to 100 while the repetition is at 0.5. You turn off the standby and the handpiece is ready. You make sure where you want to put the pin in for treatment, and once you're ready, you insert the pin into the black hole and press the foot switch for RF power to come out. So that was one treatment. So you basically use the 1-pin needle in such way. It's very simple to use. This is RF circular handpiece. It's a small handpiece which has bulk heating for RF. This is what the handpiece looks like. You press the option. You have level 1 to 10 on this handpiece. But because it's very small, we usually just start with level 10 in this case. You can always set the time on how much time of this handpiece you will use. It's up to the doctor's preference to set the time. For me, I'll just put it as 10 minutes for now, but you can always adjust it. You turn off the standby and you simply rub the handpiece onto the face for bulk heating of RF energy. This is the RV handpiece, which you use for treating vaginal healthcare issues. We do have a dummy here, and the RF energy comes out from the silver point right here. So when you're treating the patient, you have your RF cream. You put the cream on human body, and then you make sure the RF handpiece gets very smoothly inserted into the body, and you rub the RF energy handpiece within the body so the heat is evenly distributed inside. Normally, you continue this procedure to the next 25 to 30 minutes up until the heat affects the body. So this is how you simply treat the patient with RV handpiece.